Okay, we are ready to record.
Big camera.
And
Hit the big camera.
just 1 second, we're recording from 2 different views. All right. Okay. My name is Jamie Hardy, and I'm an advanced nurse practitioner student, and I'm here today working with the doctor in order to work on my advanced health assessment skills. I've been a nurse for 16 years, and so there's a couple of questions. Can you tell me today why you're here?
My employer just wanted me to get a quick well check.
Okay, so you need a well check so that you can go back to work. Was there anything specific that your employer needed us to do in order to get you cleared to go to work?
No, it's getting at least paperwork, so get it done and get y'all signed out.
Okay. Well, our plan for today is it's going to take me about 10 minutes. I have some questions that I need to ask you in regards to just your general health complaints.
Okay.
And then after that, it's going to take me about 20 minutes, and I'm going to complete your physical exam.
Okay.
Do you have any questions for me right now?
No.
Okay. As soon as we're done with a physical exam, I'll go get the doctor or the nurse practitioner. They'll come in and tell you what the plan of care is going to be.
All right, let's do it.
All right. Let's do that. Thank you for being so patient with
Yeah.
us today. So have you ever been hospitalized before?
No.
Have you ever had any major illnesses?
No.
Have you ever had any childhood diseases like chickenpox, measles, mumps, rubella?
No.
Any problems with ever having like major trauma, like a car accident or anything like that?
No.
Okay. When was your last physical exam?
About 10 years ago.
10 years ago? Okay, so it's been a while.
Yeah.
Okay. When was your last time that you had a dental exam?
About 6 months ago.
And what was the result of that exam?
Just cleaning and everything's good.
Okay. And what about your vision? Have you had a vision screen in the last 6 months?
Yes.
Okay. And what was the result of that?
Corrective lenses, contacts that I wear every day.
Okay. Now your corrective lenses, was 6 months ago the first time that your vision was corrected, or have you
No, I've had them for years.
Okay.
Many years.
On your contacts, do you change them out? Are they the disposable kind or the kind that you live in all
Disposable
the time?
once a month, clean it every week.
Okay. What about a hearing screen?
That's been a long time too.
Okay. Now, when you had that hearing screen, was it done for a specific reason, or was it just done as part of your physical exam?
Part of physical.
Okay. Immunizations. When was the last time you had some immunizations done? Do you know if you're up to date on all of them?
Yeah, everything's up to date.
You had a tetanus shot within the last 5 to 10 years?
Yeah, last 10.
Have you had your flu vaccine for the year 2016?
Yes.
Ever had a tuberculosis skin test? A
Yeah,
PPD?
about 6 months ago, and
Okay.
it was negative.
And it was negative. Good to know. All right, so I have some questions about your current health practices.
Mm-hmm.
So tell me, do you exercise?
About once, twice a month, about 30 minutes each time, maybe.
Okay. So we would encourage you to go ahead and make an exercise plan and just stick with it. I know that sometimes that can be kind of difficult. Do you smoke?
No.
Do you use any kind of tobacco products, chewing, dipping, snuffing?
No tobacco.
Okay. What about alcohol intake?
A couple times a week or a month, maybe. A couple drinks at a time. Nothing
Okay.
more.
What kind of alcohol do you normally consume?
Beer, liquor, just depends.
Okay. What about caffeine? Do you consume that on a daily basis?
Yes, tea and coffee.
Okay, no monsters, no energy
No
supplementation.
soda. No.
Okay, what about salt intake? Do you salt your food?
No.
Okay, how often do you use salt in your cooking?
Never.
Okay, sleep. How often at nighttime when you sleep, what's your average number of hours that you sleep per night?
6 to 8 hours a night.
Do you feel well rested when you wake up in the morning?
Yes.
Okay, any unusual work or stress or any anxiety?
No.
No? Good. Now, what about medications? Do you take any medications over the counter on a frequent basis?
Once, twice a month, maybe an ibuprofen or Tylenol for aches, pains, minor headache.
Okay. Any herbal supplements or vitamins? No? Do you take any prescription drugs prescribed to you by a physician?
Losartan, 100 milligrams every morning for blood pressure.
Okay. And you take that every single day?
Yes.
Good deal. Any allergies? Any allergies to any medications? No. I forgot to ask you. Do you monitor your blood pressure at home?
Occasionally.
Occasionally. And what are your average readings?
They're staying within the limits the doctor gave me.
Okay. Less than 140/90?
Yeah.
Okay. Any allergies to any medications?
No.
Any allergies to anything in your environment?
No.
Any foods you can't eat because
No.
it causes allergies? Okay. What about recreational drug use like marijuana, cocaine,
No.
methamphetamines?
None of that.
Okay. So now next questions I have to ask you. This is going to be about your family history. This kind of lets me know what kind of diseases we should look out for you for in the future. So are your parents both still alive?
Yes.
Pardon me. What about your grandparents?
No. They're all passed.
They're all passed. Okay. Let's talk about your mom's parents for a few minutes. What did your mom's parents pass away from?
Mom's parents both passed away from heart attacks.
Okay. And what about your dad's parents?
His father passed away from alcoholism, and his mother passed away from Alzheimer's.
Okay. Anyone else in the family have Alzheimer's?
Her sisters.
Okay. And what about the status health of your mother? What does she have? What kind of problems does she have?
Thyroid, cholesterol issues.
Okay. And what about your father?
High blood pressure and depression.
Okay. Anyone else? You have any other siblings?
Sister, and she has depression as well.
Okay. Any genetic disorders in your families like sickle cell, Huntington's chorea,
No.
Down syndrome, anything like that?
No.
Ever have anyone in your family who unexpectedly died without a known cause?
No.
Okay. Did I miss anything in your any family history that I didn't mention?
Not that I'm aware of.
Okay. And what year do you have any college education?
Yes.
Okay. And do you have any additional economic or stress factors that you need us to know about?
No.
Okay. All right. So a couple of things we're going to ask you here. I've got some questions related to some specific disease specific. Sorry, I'm fumbling over my words. Specific body areas. So there's a whole bunch of yes or no questions. So just answer them as truthfully as you possibly can.
Okay.
So do you think that you're in pretty good general health?
Yes.
Have you had any recent weight changes, losses, or gains in the last 6 months?
No.
Any fever?
No.
Fatigue?
No.
Headaches?
No.
Any problems with your eyes?
No.
Anything like glaucoma or cataracts?
No.
Okay, and from our earlier conversation, you said that you do wear contacts.
Yes.
Any problems with blurred or double vision?
No.
Do you feel like that your eyes shake whenever you look at words or look out into the distance?
No.
Any problems with hearing loss?
No.
Problems with your sinus?
No.
Mouth sores?
No.
Any change in voice or a sore throat?
No.
Have you felt like you've had swollen knots or nodules in your neck?
No.
Ever had any problems with nasal polyps?
No.
Any problems with chest pain?
No.
Any problems with feeling like your heart is racing?
No.
Any problems with shortness of breath with walking?
No.
Do you have any shortness of breath when you lay flat?
Mm-mm.
Any swelling of your hands, ankles, or feet?
No.
Ever had any murmurs?
No.
When was the last time you had an EKG?
Oh, it's been quite a few years.
So probably around 5 years ago,
At
best
least.
estimate.
Yeah.
Do you ever suffer from frequent coughs?
No.
Ever have any wheezing?
No.
Ever get short of breath with just normal everyday activities?
No.
Have any problems with appetite?
No.
Any change in your bowel movements?
No.
Nausea or vomiting?
No.
Any problems with constipation,
No.
diarrhea,
No.
abdominal pain,
No.
or heartburn?
No.
Any problems with urination?
No.
Any problems starting or stopping your stream?
No.
Have any problems with incontinence or dribbling?
No.
Are you sexually active?
Yes.
How do you prevent sexually transmitted diseases?
Sexual with my wife.
Okay. Do you have a problem attaining an erection?
No.
Or keeping an erection through sexual activity?
No.
Any problem with ejaculation?
No.
In your testicles, do you do a monthly testicular exam?
Yes.
Have you found any lumps,
No.
masses, or concerns?
No.
Okay. And when was the last time you had a prostate exam?
Oh, it's been a long time.
Best guess of when that was.
10 plus.
All right. Any joint point pain in your joints?
No.
Any weakness in your
No.
joints? Muscle pain or cramps?
No.
Ever had any back pain?
No.
Had any problems? Have you ever felt like one of your extremities was colder than the other ones?
No.
Okay. Any difficulty in walking?
No.
Ever had any fractures?
No.
Rash or itching?
No.
Any kind of unusual lesions or hair loss anywhere in particular? What about your skin? Is your skin normally dry or is it well moisturized?
I'm not sure.
Okay. Any changes in your breast?
No.
Any abnormal lumps or bumps?
No.
Any discharge from your nipples?
No.
Ever have headaches?
No.
Lightheaded or dizzy?
No.
Ever had a seizure?
No.
Ever feel like part of your arms or hands were going numb and tingling?
No.
Ever had any tremors?
No.
Ever had a stroke?
No.
Ever had a head injury?
No.
All right. Any problems with memory loss or confusion?
No.
Nervousness?
No.
Depression? I'm sorry, sir.
No.
Insomnia?
No.
And you have an adequate support system?
Yes.
Any problems with excessive thirst or urination? Do you feel like you drink more or go to the bathroom more often than normal?
No.
Do you ever feel like that you're wearing either more clothes or less clothes? I'm sorry. More clothes or less clothes in relation to your environment?
No.
Have you had a recent change, or have you ever had to change your wedding ring size?
No.
Have your feet grown since in the last couple of years to a
No.
different size? What about your hat size? Has it changed?
No.
Do you have a bleeding or a bruising tendency?
No.
Ever had anemia?
No.
Ever had a past medical transfusion?
No.
Okay, that is all of those questions. Thank you very much for being patient with me.
Okay.
Now then, the next part that we're going to want to do is we're going to actually want to go ahead and do your physical assessment. For the purposes of this exam, I'm going to be speaking to you and speaking to the camera at the same time. So
Okay.
just answer my questions whenever I come to you, okay?
Okay.
All right, so what I have is Mr. Jose Gonzalez. He is a 50-year-old male patient. He looks younger than his stated age of 50. He is well groomed today. He is dressed appropriately for the weather outside. He appears to be in a good state of health. I'm going to first look at his skin and kind of see, palpate his skin and kind of see what I can see. I don't see any obvious physical deformities. I will say that when Mr. Gonzalez walked in, that his posture was erect and his gait was steady and stable. So, first thing I'm going to do is I'm just going to touch your skin. His skin is very supple. He's got nice pink undertones. He's got good skin turgor. I'm looking at his capillary refill. It's less than 3 seconds. He's able to follow commands. He is he's doing well right now. Okay, so now what I want to do is I want to kind of test some of your movements of coordination so we can make sure that neurologically you're intact.
Okay.
So if I can get you to just put your hands up like this, and then we're going to just do finger touch to your thumb, and then try to do that as rapidly as you possibly can. Okay, good. Now then, I want you to put your hands down on your lap, and then flip-flop your hands back and forth really super fast. Good job. Thank you very much, and that's good. And that lets us kind of know that he has neurological intactness. So the next thing I want to do is I want to test some of your reflexes to make sure that your reflexes are nice and are within normal limits. So we're going to start with the one here. So if you'll just relax your arm as much as you possibly can, just go in. Let me have it. Go. And touch. Good. Okay. And then we're going to come this way. Touch here. And then we're going to go down to the patellar reflex. Okay. And then we'll go down further onto the ankle. Make sure the camera's still on you. Okay, just relax your legs as much as you can, sir. Just relax. Thank you. Good. And we'll do that on the other side as well and check to see what the reflexes look like on both sides. Okay. Next thing we're going to do is we're going to examine the patient's head. I see that the head is symmetrical and it does not appear to have any obvious deformities on it. And I just want to go ahead and I'm going to fill the head, making sure there's no masses, filling of the hair texture. The hair is very supple. There's no abnormal lumps or bumps. I'm going to come down and fill the temporal arteries. Good. And I'm going to fill the sinuses. Does this hurt when I press on your side?
No.
No? Okay. When you lean forward, do you have an increased pain in your face?
No.
Very good. So then I want to actually ask the patient to, I'm going to test with some of his cranial nerves. So I'm going to look at cranial nerve 7. It's the easiest one to do, the fastest. So give me a great big huge smile. Good. The smile is symmetrical. Now raise your eyebrows. Good. Now I want you to close your eyes really tight, but don't let me open them, okay? Good. And then the next thing I want to do is I want to test for facial sensation. And I'm going to take a white cotton swab like this. And I'm going to touch your face in a couple different places. And if you can say left cheek, right cheek, forehead, okay?
Forehead, right cheek, right cheek.
Good. So cranial nerve 7 is all intact. Now then I'm going to move on down to the patient's eyes. And there's a couple different things that we're going to look here at the eyes. First, we need to make sure that the eyes are both symmetrical and that we don't have any lid lag and that the eyelids are appropriate and they don't have extratropian or entropian, and I don't see either one of those. I'm going to look to see that the sclera are white. I'm going to pull down just very gently here on the front of your eyes. Looking at the conjunctiva, it's nice and pink, indicating that we've got good red blood cells. Also, too, I want to look at his eyes, and we're going to test a couple of different cranial nerves associated with the eyes. So the first one we can do is the corneal reflex, just by simply indicating a stimulus. And we see that the patient does blink whenever a stimulus approaches the eye. He blinks. The other thing I want to check is I want to look at the patient's pupils. The pupils are equal and they're round, but I want to see if they're going to accommodate to light and also to vision changes. So I take out my pen light like this, and I have the patient looking right here at my nose. I'm going to shine a light in his eye, and I'm looking to see if the pupil's going to dilate. And it dilates on that side, and it dilates on that side. That's direct confrontation. Now I'm going to look at consensual confrontation. So instead of looking at this, I'm going to see if this eye dilates, and it does, and it does. Very good. And that would be cranial nerve number 2. Now then, I want you to follow my finger just with your eyes. Don't move your head back and forth. Just going to follow it through. It's got good lateral eye movement. We go up, back down, back down. Again. Good. And what I see is that cranial nerves 3, 4, and 6 all look like they're intact. Okay, so I want you to pick a spot over the wall for me. Stare off. Now look back here at my finger. And his pupils actually constrict whenever they looked back at my finger in a close manner. So that is wonderful. Okay, the next thing we're going to do is a Snellen chart. The Snellen chart was actually done by the medicine assistant at Wing before he came in. In his case, we could do a pocket Snellen chart due to his age because of being nearsighted at this age, or farsighted at this age. The other thing that we're going to do is we're going to look at his eyes, and we're going to actually use the otoscope to look inside his eyes to check for the red reflex in the optic disc. Okay. So what I want you to do, sir, is look right here at this ear for me. Okay. Look in your eye. Turn that inward. From the red reflex and my optic disc. Good. I'll put that away. And then we're going to do it on this side. Same process. Red reflex, optic disc, looking for your papilla, edema, and I can't see it. Okay. So after that, then the eye exam is completed. Let's now look at the nose. From the outside of the nose, I can see that it does not deviate to the left or to the right. Let me get you to do me a favor, sir. Put your finger up here at your nose and take a deep breath in. And then on the other side. Oh, I'm sorry. It's okay. There's a lot of stuff in the air floating around right now this time of year. Ooh, I bless you, sir. Do you need a tissue?
No.
You're good? Okay. So I can hear that the nasal patency is not equal, that's a normal finding in most people. It sounds like he's got better airflow coming out of the left nostril than versus the right one. Now the next thing I want to do is actually want to look inside of his nose to look for any septal deviation, make sure that the septal wall is intact. Okay? If I can get you to tilt your head back just a little bit. Look inside your nose. This one is red. You got a little bit of drainage coming out of it, not so clear. This one is a little pinker. I don't see any turbinates or nasal polyps. I do see a little more mucus in both of those nares. Okay. Also, too, part of the cranial nerves here. Excuse me. Big thunderclap here. A part of our assessment here is we want to ensure that his cranial nerve number 1 is intact, which is the ability to smell. So if you'll close your eyes for me, sir, I'm going to have you smell something. You'll just tell me what this is. Alcohol. Very good. Okay. So the nasal part of that one is done. Next, I'm going to move down to your jaws. Just want you to open and close your jaws. Just going to feel your joint. Any pain whenever that happens?
No.
Now bite really hard for me. Good. Any pain in there when I?
No.
No? Okay. That's cranial nerve 5 that he can open and close his jaw, so we're good there. Then the next thing I want to do is I want you to stick your tongue out at me. The tongue is straight when it comes out. That's cranial nerve number 12, so we can check that one is good. Then I want to look at both his hard palate and his soft palate. And my glove box has eluded me, so let me get you a pair of gloves. Thank you, sir. You're a very helpful patient. Okay. So I'm going to have the patient, and it appears as though my tongue blade also walked away. Okay. I'm going to have the patient open his mouth for me. I'm going to look inside. I'm going to observe the mucosal surfaces, both the hard palate and the soft palate. The hard palate appears intact. Look your tongue for me, please. The soft palate looks intact. And then I'm just going to use my hands, and I want to move around the mouth, looking at the palate, looking for any kind of abnormal masses, feeling of the cheek. Not seeing anything. Okay. Now then, I'm going to have you to open your mouth really, really wide for me. I am going to be checking your gag reflex, so when I do this, it will make you gag. So if you'll just say "ah" for me real big, say "ah." The pupil goes straight up, and we have an intact gag reflex. Thank you, sir. I know that's most unpleasant.
Yeah.
That would indicate that our cranial nerves, both 9 and 10, are intact. Okay. Moving down the neck, now what I'm going to look at is I'm going to do a couple of different palpation moves because I want to feel a patient's lymph node system. So we're going to look for the occipital ones, posterior auricular, preauricular, tonsillar, submandibular, submental, and then the supraclavicular. And I don't feel any of those. While I'm here at the neck, I'm going to go ahead and palpate the trachea. Trachea is midline. Go ahead and swallow for me. Good. I don't see the thyroid bone having any large nodules. I was able to palpate the ischial part of the thyroid gland. Now let me get you to go ahead. I want you to turn your head against my hand on this side. Good. And on this side. Good. And that would be cranial nerve 11 is intact. And then go ahead and shrug your shoulders for me. Good. And once again, another test to see that cranial nerve 11 is intact. Pardon me. Excuse me. Next, we're going to look at the patient's ears. From the external examination of them, I don't see any tophi, I don't see any abnormal masses on either ear. Does it hurt back here when I press?
No.
Does it hurt here when I'm pressing your tragus?
No.
If I pull here, does it hurt?
No.
If I pull here, does it hurt?
No.
Okay. Next, I want to look inside the patient's ears using an otoscope. So we pull them back. The ear canal is pink. The tympanic membrane is gray and a positive cone of light. Ear canal is pink. Tympanic membrane is gray with a positive cone of light. Okay. Then the next thing I want to do is I want to test the patient's hearing. There are two different tests we can do with this, the Rhine, the Weber, and then also the whisper test. For the purposes of this exam, we're going to do the Rhine and the Weber. Okay. All right, sir. What I'm going to do is I'm going to take this tuning fork and I'm going to strike it on my hand. I'm going to place it on the top of your head, and then I need you to tell me if you hear the sound the same in both ears, okay?
Yes.
Okay. And the next thing we're going to do is the Rhine test. The Rhine test, I'm going to strike it here on my hand. I'm going to place it on this bone back here. When you no longer hear the sound, let me know, and I'm going to flip it over and stick it next to your ear. When that sound goes away, please let me know.
Okay.
Okay. And so what we found there was that bone conduction was longer than AC conduction, which would be air conduction was longer than bone conduction, which we would find as a normal finding. We can also go ahead and do that to the other ear, but for the sake of the time and for this exam, we will when we test one here today. Okay. Then our next thing on our list to get done is going to be an assessment of the posterior surfaces of this patient. So we're going to ask you if you can turn this way to the camera. Okay. So as the patient's turning, I'm looking at his anterior posterior diameter, and I see that we are appropriate. We're not wider than we are across. That would, if being barrel-chested or pigeon-chested, what could indicate that there are some other abnormalities going on, COPD or like Marfan syndrome. So for this patient, I look at the back, and I can see that his that he's able to maintain his posture. One of the first things I'm going to do, since I have him here already, is just going to palpate down the spine and down the neck, down the vertebral column. Is this causing any pain anywhere, sir? Okay, good. No pain at all? And since I already have him sitting here too, I'm going to go ahead and check costovertebral tenderness just to be sure. So I'll put my hand over the kidney and give it a good thump. Let me know if this causes any pain. No? And the next thing I want to do is I want to assess for tactile firmitus. This is letting me know whether or not there's any problem with the word. Any masses or thickening of the fluids. Can't say consolidation. Consolidation in the lungs. Okay. All right. So to do tactile firmitus, let the patient know. I'm going to be pressing on your back pretty hard, so you want to support yourself. When you feel my palms touch your back, you can say the word 99.
99.
Thank you, sir. The tactile firmitus on either side is equal, so I'm not concerned about consolidation or masses. To confirm that, I can do percussion therapy, and so I'm going to percuss down your back now, okay, sir? Just going to put me lightly tapping. Based upon percussion, I don't see any differences or changes in the sound from the left side to the right side. So I'll go ahead and I will proceed with listening to his breath sounds. Okay, sir, just take a deep breath in for me. And out. Again. 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 The last thing I want to do before I leave the posterior side is I want to look for thoracic expansion. So I'll measure down to about where the 10th intercostal rib space is. Okay. All right, so let me just take a big deep breath for me in and out. Good. And what I'm watching for is that my thumbs and my hands move equally apart, and they did. So I'm pretty assured that he doesn't have any pleurisy or atelectasis on one side or the other. Okay. After the posterior side's done, then I'll have the patient turn back around and we'll work on the anterior side doing the respiratory assessment. So everything I just did on the posterior side, I can flip around and now do on the anterior side. So the first one that I can do here is we do thoracic expansion again. Once again, take a deep breath in that one. Good. And I saw my hands move equally apart at the same time. Then I want to do tactile firmitus. So I'll have the patient say 99.
No.
Okay, and then once that's done, then we can also work on doing palpation in order to determine if there's any extra fluid. So. And we now complete the palpitation. So now then I can go ahead and go back now and I can listen to breath sounds. Take a deep breath. At this point, I'm going to worry about completing his cardiovascular exam. So I'm looking at the chest for for heaves or lifts, looking to see if the heart is bouncing against the top of the rib cage. And I don't see that. Definitely want to go ahead and make sure I palpate though, and feeling over the area of the heart, see if I feel any thrills with my fingers. And I don't. Okay, and then I want to go ahead and just take a moment and using my stethoscope, both the bell and the diaphragm, I'm listening to his heart sounds. Starting with the aortic valve closing. Tricuspid. And the mitral valve. And going back and listening again, this time pressing a little bit harder so that I'm actually using the bell of my stethoscope. Take a deep breath in and hold. Okay, you breathe normal. Okay, turn your head just slightly that way for me. Same for carotid bruise. Take a deep breath in. Hold. Good, and take a deep breath out. Same thing. No carotid bruise noted. All right. Now then, I'm going to allow you to, if you don't mind, can you lay back for me right here? So next what I want to do is I want to look at the abdomen, but I'm also going to go ahead and finish off my cardiovascular assessment by just palpating his pulses, okay? So I'm going to come up here and I'll start with the carotid. We'll do them one at a time. And feeling for the patient's brachial pulses. And then the radial pulses. Popliteal pulses. Tibial pulses, post-tibial. And then the dorsal sinus pulses. All right. Okay. Now then we're going to work on the abdominal assessment portion. So with this patient, the first thing I do is look at the abdomen and see if there's any abnormal lumps, bumps, masses. Look at the contour, make sure it's nice and even. Make sure there's no like undulations or things that are out of the contour range. And then the next thing I want to do is look for any striae, piercings, or tattoos. This patient said he has no tattoos and no piercings, and I don't see any striae present on the abdomen itself. So with the abdomen, the first thing I want to do is actually want to listen to it. I'm going to listen in each quadrant, see if we have vowel sounds. Then listen here in the center for an aortic bruit. And on each side over here for a pulmonary bruit. And I don't hear any bruits. The next thing I want to do is I want to percuss all four quadrants, listening for the resonance. Okay. And then the last thing I want to do is just palpate his abdomen. Anything when I press her?
No.
Good. Anything out here?
No.
So no abnormal findings in the abdomen, no masses, everything felt pretty soft. Okay, last thing we're going to do is we're going to have the patient, we're going to test his muscle tone and strength. So what I want you to do, sir, is I want you to hold your arm up for me just like this. Good, now push me down to the bed. Good, now flip your palm to the sky for me and push me up. Good, and let's do it on the other side. And push me down. Good. And turn your foot over. Up. Push me up. Good. Then we're going to do the same thing for the legs. Hold this leg up for me. Good. Push me down to the bed. Good. Now kick away. Great. Other side. Down. Good. And up. Good. And then the last thing I'll do is just check your strength in your feet. Okay. Push against me. Good. And pull forward. Great. Okay. So, in conclusion, what I found in my patient today was that I have a 50-year-old male patient who came in today with a good affect, who is here for a health physical to be able to go to work. I found that the patient, his lungs were was alert and oriented, that he had a normal eye exam, a normal ear exam, heart surround sound S1, S2, did not hear any extra beats. His rate and his rate was regular. I heard clear lung sounds anteriorly and posteriorly. I found that the patient's abdomen was soft with no masses and no guarding and no tenderness, and I found that his muscle strength was a 4/4 in all extremities. His pedal pulses, all of his pulses were normal. So basically, this was a normal health and wellness check for Mr. Jose Gonzalez. He is now the physician will come in and will verify my findings, and then Mr. Gonzalez can have his work so he can return to work. Okay, this is Jamie Hardy. Thank you very much for watching. We'll see you soon.